Okay, this is Joe Johnson from Cancer Dudes Live More, and today I have a special guest with me. It's Dr. Kevin Connors, who is an integrative cancer expert who practices in Minneapolis, Minnesota. He is the author of the book Stop Fighting Cancer and Start Treating the Cause, and his website is www.upperroomwellness.com, and he's also teaches doctors about integrative cancer therapy, and I had the pleasure of attending one of his seminars last summer and really learned a lot, so I'm excited to have him with me today, and we'll learn a little bit more about cancer. So thanks Dr. Connors a lot for coming on today.
Sure, Joe. Hopefully I can be a help for you.
Yeah, definitely. So, I guess the first question, you mentioned your book, Stop Fighting Cancer and Start Treating the Cause. Now, I know there's not one cause of cancer, but what are some of the potential causes that go into, cancer developing in somebody's body?
Well, I think that's an issue. There's a reason why I titled the book that way. There's a huge issue in our country in that people think that if we can use chemotherapy or radiation or surgery to remove the bulk of the cancer, then somehow we're cured of cancer and we've solved our problem. But I have never once had a patient walk in my door that's gone through the conventional route and been able to answer the question, so what's the cause of your cancer? They look at me with a blank stare and go, oh, what? And, my comment is I always think it's in the best interest of the patient to find the cause of your cancer, because even if we could wave a magic wand and make it all go away, which erroneously doing chemo and radiation and surgery does not do that, no matter what the patient is told, that even if that was possible, if you didn't get rid of the cause for that patient, the chance of it coming back is at least greater. So to answer your question, what are the possible causes of cancer? Well, there's maybe 10,000. So I don't want people to be running scared like, oh, I'm never going to barbecue a burger ever again because that causes cancer.
Right.
But also there's some things that you can do in life to make wiser decisions. And you can find out what the cause is. So using a special type of kinesiology that we use, we always find the cause of that individual's cancer. Now, unfortunately, out of maybe 50 patients, there's 40 different causes. So there's a few things that are maybe a little bit more common than others, but when I say a little bit more common, out of 50 cases, maybe 3 of them had a cause of an old vaccine or a H. pylori, and then there's maybe the rest of them are all just scattered different possible causes.
And so it is possible for guys to figure out what the cause of their cancer is.
It's not only possible, I think it's important. Though sometimes the cause isn't relevant in that there's not a current exposure. So let's say I have prostate cancer, and I was able to find out the cause of my prostate cancer was an arsenic toxicity. And if we checked all my current exposures of my drinking water and food and things where I would possibly get arsenic toxicity now, it was maybe because I lived on a farm when I was a kid, and my dad used an herbicide that had a high amount of arsenic in it, and I was exposed to it. So the current exposure isn't there. It's still, I believe, extremely valuable to chelate out that arsenic out of that person's body, even though you might use something completely different to kill the growing cancer cells. So finding the cause in that case would be extremely helpful. So if arsenic was able to change the body's ability to kill a growing cell, cancer cell, one time, it certainly could cause cancer to grow again.
Mm-hmm.
So finding the causes is very necessary.
Mm-hmm. And so how do you go about finding the cause then?
Well, you could do different functional medicine tests
Mm-hmm.
to test for heavy metal toxicities and different types of insidious bacterial infections like H. pylori or chlamydia or something like that that people can have for 20 years and never know that they have it. Those are called subclinical infections that people have that can be the cause of cancer and other autoimmune issues as well. But I use some of those functional medicine tests. I love to do tests, but I use a special type of kinesiology to really find out what that cause is.
And for people that don't know what kinesiology is, can you tell us a little bit more about that?
Kinesiology, there's a lot of people that... Kinesiology is muscle testing. The word kinesiology just means movement by muscle. There's multiple different techniques of offshoots of what was called applied kinesiology. I use kind of my own brand and technique of applied clinical kinesiology. That's that I've just developed over 30 years of doing this.
Sure. And now, something that I found interesting at your seminar was, kind of how you describe that all of us have cancer in our bodies. Can you talk a little bit more about that? Even people that don't have a cancer diagnosis.
Sure. I think it's important to understand what cancer is. So cancer is normally everybody's cells. Let's use your liver cells. So your liver cells, about every 6 weeks, your liver cells will reproduce another cell, and then that old cell or that mother cell then dies. And then that new baby cell lives about 6 weeks and reproduces another cell, and that mother cell dies. And so that happens. You're reproducing, you're getting a new liver really 24 times a year, right? So that's really what aging is that every time you reproduce a new cell, it's slightly degenerate because of environmental factors and things that are going on in your life, and that's you're just aging over time. Now, that mother cell that is supposed to die when it reproduces another cell, sometimes that mechanism that is supposed to cause that normal programmed cell death, that's called apoptosis, that mechanism can get broken, and it doesn't die. So it might 6 weeks later reproduce another cell, 6 weeks later reproduce another cell, and then finally go through apoptosis and die. Well, if that's the case, that's fine. It's not hurting anything. The second thing that takes place in order for anybody to get a diagnosis of cancer is that not only does there have to be a broken apoptotic cycle, a broken normal cell programmed cell death cycle, but there has to be a break in the there has to be a break in the replication cycle. So not only is it replicating every 6 weeks, but now it's replicating 6 times a day. So the replication cycle, there's something wrong with it. And these programs in the cell are very complex. And think of your cell as like New York City. There's a zillion things going on inside there. And that the apoptotic cycle is affected by special receptors on the cell membranes. Think of those as like street or highway entrances into the cell. That then there has to be something that enters into the cell and a connection take place in that cell in order for apoptotic processes to begin and the cell dies. Same thing with replication. There's all sorts of different things that need to take place in order for that cell to start replicating. And if it gets broken, it could go get like a gas pedal stuck on. It starts replicating faster and faster and faster. That's what takes place in all of us. At different times, we might have a broken apoptotic cycle in our liver and a broken replication cycle in our liver. So we got this cancer mass actually starting to grow. Now, thank goodness, the fail-safe method of keeping us from getting a diagnosis of cancer is our immune system.
Mm-hmm.
So when that cell, or that mass of growing cells that are called truly cancer,
Mm-hmm.
starts to grow in our body, and it gets to be 500, 1,000, 10,000 cells, sooner or later our immune system is supposed to recognize it as an enemy. Like, what in the heck is that there?
Mm-hmm.
Let's kill it. And your immune system will fire a response against it and destroy it.
Mm-hmm.
So that's your fail-safe method of keeping you from getting quote-unquote cancer.
Mm-hmm.
And if that is also broken, then you've got cancer. Then
Mm-hmm.
you're going to get cancer. You're going to have the diagnosis. You're going to have this mass now in your liver or wherever this process has taken place.
Mm-hmm.
And now we have a problem.
Mm-hmm.
So
Mm-hmm.
having these three broken processes,
Mm-hmm.
broken apoptotic pathway, a broken replication pathway, and a broken immune system.
Mm-hmm. Mm-hmm.
It's killing this.
Okay, sure. So it would seem that having a strong immune system is very important for someone with cancer, or to prevent cancer, or prevent recurrence of cancer.
Yeah, very, very strong.
Mm-hmm.
That's your final fail-safe method. So, and a person can have this breakdown in the immune system that isn't necessarily chronic. So
Mm-hmm.
they can already have, like everybody does, some cells that aren't going through apoptosis,
Mm-hmm.
some cells that aren't going through apoptosis and are replicating too quickly.
Mm-hmm.
And then our immune system is always cleaning them up, and we never end up having a problem. But we go through this huge stressful time. We just lost our job. We got foreclosed on. We're having relationship difficulties.
Mm-hmm.
We're going through a stressful exam, final exam process in school. Whatever it is, stress decreases our immune response. So
Mm-hmm.
we can even have very short-lived stress response that is just at a very inopportune time.
Mm-hmm.
So that cancer can take a foothold
Mm.
and start going to the size that the mass gets too big for. Even now, I got a healthy immune system. My stress is gone, and my immune system perks up a little bit. But now this mass has gotten too big for it to handle, and it's unable to kill it.
Mm-hmm. Okay. And so at that point, then, once someone has the cancer diagnosis, then what? Then kind of what's next for them?
Well, it depends on which route they go. Usually, they have a cancer diagnosis. Cancer typically isn't painful, so it's not something like, oh, my liver's hurting, I'm going to run to the doctor. They have other things. This cancer has been growing, for quite some time.
Mm-hmm.
And now it's gotten to the size of a 7-millimeter mass in my liver,
Mm-hmm.
and maybe some of my liver functions have decreased, and I maybe have just some chronic fatigue. Most
Mm-hmm.
cancers are found through an incidental exam
Mm-hmm.
with people.
Mm-hmm.
They end up
Mm-hmm.
getting some blood work back, and their blood work, their liver markers are a little bit off, and so some further investigation is done, and then they're found that they have this mass in their liver.
Mm-hmm.
Usually, the problem with that is that what does that produce? In somebody, you might have cancer, Mr. Johnson. So we're going to have to do a biopsy of this liver mass that we found.
Mm-hmm.
Usually, people are, oh, great, that's fantastic. Let's get this taken care of, and we'll be on our way to a healthier life.
Mm-hmm.
They're like, what? Cancer? Oh my gosh, Uncle Ned died of cancer. Maybe I'm the other one who's going to die of cancer. Nobody else in my family has died of cancer. I guess somebody has to die of cancer. It's going to be me. I'm going to die of cancer. So all this fear sets in, all this stress response, and all these stress hormones do what? They do nothing but fuel cancer because they suppress your immune response. Now, you super suppress immune response because you're scared to death the cancer even grows more rapidly, and that's not good. So then what happens, typically people are in a comatose state mentally and make decisions that their rational mind maybe wouldn't have made. Like, all right, the doctor said I'm supposed to do this, so I'm just going to do it. He said I'm supposed to do a biopsy, so I'm just getting a biopsy. And they have friends and family members that are scared to death. That, well, it's just what the doctor said, just do it, whatever. He knows best, just do it. So to think of doing some alternative paths is just, it's difficult for people to swallow that right away. Because it's difficult for people to think rationally.
Sure.
So they tend to go down that medical route, and they tend to get a biopsy. What can a biopsy do? It's not disputable anymore that a biopsy spreads the cancer. But that's the only way that we can get a definitive medical diagnosis. So get a biopsy. Yes, you have cancer cells. That's what that is. You got 7-millimeter mass in your liver. We need to do chemotherapy. So, all right, well, they're scared to death again, so I just better do the chemotherapy. I trust my doctor. He'd never lead me the wrong way. And I do the chemotherapy, and, people can have good results, bad results. We usually see the people that have bad results that finally have spent some time with this now and have suffered enough that they're starting to rethink their decisions. And then they usually call us. But maybe it would be better for them if they would be able to take a step back from their diagnosis a bit and think about it, but it's difficult.
So do you have any, recommendations on how guys can deal with that fear and that stress and strategies to cope with it and to kind of get to more of that rational place?
I think one of the ways to do it is to be careful who you share your information with, because your loved ones are going to tend to push you towards a standard medical approach, because I believe in the 13 years that I've been seeing patients with cancer, it's mainly because it absolves them from any responsibility in this case. Well, just do what the doctor said, then somehow, if I can push you to do what the doctor says, then somehow I feel better about myself because at least I got him to do. Because then if it fails and he dies, well, then it's the doctor's fault. So it keeps me safe. And then somehow we feel like we've done our part in that way. So any advice I could give to somebody whose loved one has cancer is to just help them to take a step back, maybe go on a little vacation, even if it's just for a weekend, walk on the beach and just really contemplate, where do I want to be? How a person makes a rational decision regarding anything in their life has to do with looking at what are the pros, what are the cons, making a list out and saying, okay, if I do the chemo, these are my possible side effects. And do some research. What's the real benefit of the chemo? You really do the research. There's a very, very small benefit of chemotherapy. If it's the last ditch thing and you've tried every alternative thing and you're not getting better, well, then that's what chemo is for. That's what drugs are for. But you gotta sit down and be logical about it. And if you can't be that kind of person, because some people just are very emotional individuals and they can't be that kind of person, you got to find somebody in your life that can be that rock for you. Let's just settle down here a little bit. Let's look at this rationally. Let's look at this logically. Let's go through a list here. What would be the positives of going this way? What would be the negatives? What would be the positives of going this way? What would be the negatives? And understand, doing something alternative like what I do it does never mean that you can't do chemo or radiation or surgery also. So there's no contraindications from a medical standpoint doing alternative things as well. So, I always say that doing an alternative approach to cancer is absolutely necessary. Doing a conventional approach, that's what's optional. You don't change your lifestyle, change your diet, change some things that got you where you are right now. You can go have your liver removed and have all your organs removed, and the cancer is systemic already. So you're just going to die in 2 years instead of healthy.
Right. So what? So what are some of those necessary things that guys are going to need to change?
Well, definitely you have to look at your stress levels because obviously stress is a contributing factor to just about every disease, and it can be the main causative factor of why the person's immune system tanked whatever period of time they got this situation in the first place. And secondly, you have to. Sorry about that. You have to look at. I'm trying to figure out what I'm doing here, so I apologize. You have to look at diet, just general life, the way you've been looking at your life. Diet is huge. So even though maybe diet wasn't the cause of that person's disease process, it is certainly a factor. Getting nutrition to the cells is the most important thing. You can argue that health of the gut and health of your barrier systems, that is the barrier of your gut, the barrier of your brain, the barrier of your arterial system is everything. And that's probably the start of most diseases, is a breakdown of the barrier system. So healing the gut, just doing some things nutritionally to get back on track. It doesn't mean that you have to become this crazy guru and juice 20 times a day and never eat again or anything like that. Because even though I write a lot about diet in my book, I test everybody out individually. So a lot of people, they can still eat meat. They can still eat, many of the things that they like. I don't think you need to cut everything out everything that you love is gone now. So some people just wish they were dead. But you don't have to become a guru to start making some right decisions that just tip you to the positive side.
Right. And so what are some of the most important things to do around nutrition?
Well, some of the most important things are to heal your gut.
Okay.
And that might be going to somebody that can test out your gut in different functional medicine tests if they don't do kinesiology. Make sure that they get that underway. Alkalize your body, and that is almost always done through healing your gut, getting enough HCl in your stomach for digestive processes, digestive enzymes to help digestion, and to increase your greens that you're eating. So that can be done through juicing, that can be done through using a powdered greens product. That can be done through just some different dietary changes, like getting off drinking sodas and different chemicals like diet sodas and things. So it doesn't have to be these drastic changes. Just changes, even slowly, can make a big difference to help alkalize your tissues.
Okay. And so you mentioned healing the gut. What are some things that are going to help with that, with healing the person's gut?
That may have to do with seeing if the person has some food sensitivities, dairy sensitivity, gluten sensitivity are tops there. May have to do with, again, going back to finding the cause. Heavy metal toxicities are very commonly a causative factor for damaging gut, the intestinal border. So dealing with heavy metal toxicity, chelating that out. There's some good products on the market that are very palatable to help heal the gut. Some that I'm sure you already use in your practice that you could refer people to that are very good gut healing nutritional products that are combination products that are easy to take. So, and then looking at, as far as diet, what the gut is trying to eat as little GMO foods as possible. That's most damaging things to the gut.
So how do GMOs affect the gut?
Well, GMOs basically they're beneficial to the farmer, well, it's arguable that they're beneficial to the individual farmer, but how they're beneficial to the company is that they become the reason why GMO corn is more resistant to corn borers, the little bugs that eat corn, the little worms that eat on corn, is that GMO corn has a chemical in it that will rot away the gut of the corn borer and kills them. So they don't like to eat GMO corn. Therefore, it's more resistant to corn borers. Well, if it's rotting away the gut lining of the corn borer, what is it doing to us? You know, a lot of GMO corn, it's going to affect our gut lining. So there's some new studies coming out, many of them that are hidden, that show the dangers of GMO food. Many countries are become so. Most of our corn is GMO. You still getting the video, Joe?
Yeah. Yeah, just froze up for a minute there, but now I think it's good.
Okay, good.
Is it okay on your end?
Yeah.
Okay, great. Yeah, so that's a little bit about nutrition. Now, with people that you see, do you make recommendations to them around like fitness and physical activity and things like that?
Yes. With cancer patients, you don't want them to work out like a cardio patient. Matter of fact, you'd really recommend opposite types of workout. So someone who has cardio issues, like a history of myocardial infarction or history of any type of chest pain or something, you have them working out doing more an interval type workout. Person with cancer, you do not want them just exhausting themselves. So you'd have them just doing long walks and that type of fitness. And they could lift weights, but they wouldn't lift weights to the point of exhaustion. They lift weights just for toning purposes. At least while they're recovering.
Sure, right, sure. Or maybe, something like yoga or some kind of more relaxing movement.
More of a relaxing movement, something that is more toning to the muscles and not as demanding oxygen.
Sure. Because, and possibly something like you said, that stress reduction is so important too, right?
Yeah, that's so important.
So what do you recommend for your patients around stress reduction and things like that?
Well, we run a very spiritual practice. We come from a Christian perspective, so we speak to them, a lot about that, the whole emotional component, spiritual component of their disease. We found that patients that get to the point of being able to embrace what they have going on in the sense that that they can see the good in all of it, tend to do the best. Patients that understandably, we all have to go through different phases when we hear cancer or some grave disease or something like that. And grief is one of those phases that everybody kind of needs to go through. When we see a patient that gets stuck in that and maybe is stuck in anger or that's not good. That's not healthy. That produces nothing but bad chemicals in their body. Your emotions are extremely important. The patients that we see do the best are the ones that accept this, that hey, we're all going to die. I'm not looking to live forever. And if this is the way God's going to take me home, then this is the way God's going to take me home. But I got to be wise, and I got to make the best decisions, and I got to do everything that I possibly can. But I've accepted this, and not that I'm accepting my death, but I'm accepting the situation that there's something good in this too. That it's driven me to slow down a little bit. It's driven me to thankful of my children, or spend more time with my grandkids, or look at my life differently, or the things that I valued before I knew I had cancer, now I don't value as much. It's changed my values, it's changed my ethics, it's changed my morals. So everything happens for a reason, and when we can embrace that and not look at, not make judgments like, oh, cancer is bad and I got to get rid of it. But it's like, okay, this is just something in my life, and though I don't want to have it and I don't want to die, I got to look at what I can learn from this and how I got to grow from this and how this is going to be a blessing in my life. I know it's hard for a cancer patient to understand this, depending on what level they're at. But when I have a cancer patient that gets to the point when they're actually thankful for their cancer, they're the ones that win. What I call winning, accepting it, and usually living a long, long life, even though they have a diagnosis of cancer. And they're at peace about it. So it's not just, you talk a lot about quality of life. I don't want to do chemo because my quality of life is going to be crap, and even though I might live for 6 more months, I wouldn't even want to be alive those 6 months. But also quality of life has to do not just with health quality, but your state of mind. So if you don't have any peace in your heart and any peace in your mind, there's not a whole lot of quality there. So we talk a lot about that with our patients. We try to help them through, those, they have to go through the grief, they have to go through the anger, but you don't want to be stuck in it.
Right. Yeah, that's definitely something I've heard of all kinds of stories of, people with these just great healing stories. That's something that's so important, is just accepting their situation and seeing the opportunity and seeing the benefit, seeing the good that can come out of it. It's just really important.
That's right.
But so I mean, are you able to tell any stories of people that had come in to see you and kind of, what their situation was like and kind of how they recovered?
It's hard to do that because once a patient is my patient, they're kind of always my patient.
Sure.
And there's some that will watch this video, I'm sure.
Right.
So I don't want to be too personal. We want to respect everybody's privacy. But, the greatest benefit that I have in my life is to see patients that were supposed to be dead a year ago or 2 years ago or whatever, and they're not dead. So, and not only are they not dead, they're happy and they're living their life, and they're not constantly consumed with healing their cancer, and that's not on the forefront of their mind. One of the things we tell our patients, we do not want, and I think it's one of the worst things you can do, is to make an idol out of healing your cancer. And that become a god in your life that you're completely consumed with. I want you to live your life, for goodness sakes, and spend time with your kids and grandkids, or your wife or significant other.
Right.
It's no good in my life to keep you alive for another 4 years and have you just be consumed with cancer, and that's all people remember you for. If when you do die, is that you struggled with cancer the last X amount of years. What a waste that was. So, regardless, I honestly think, because I'm very left-brain in the sense that I want people to have success and that they're cancer-free and that they can move on with their life. But in truth, we're never cancer-free. You and I don't have a diagnosis of cancer, but we're not cancer-free. Somebody who has had a diagnosis of cancer is never going to be completely cancer-free. But you could get to the point where you don't think about it anymore. And you can go a day and you didn't think about your cancer, or you can go finally a week or a month where you didn't think about your cancer. To me, that's when you're really free of cancer, and when you're free from bondage mentally, being consumed by it.
Mm-hmm.
having victory over you.
Mm-hmm. Mm-hmm. Right. And but I guess just in general, you said that you see a lot of very serious late stage people coming into your office, and even those people have had a lot of great success, is what it sounds like.
Well, unfortunately, and I say that, I shouldn't use that word, but most people come to me when they've tried everything else.
Mm.
So we had a stage 1 prostate cancer patient come to us this year in 2013, and we went back to our records, and I don't think, at least I can't recall, other stage 1 cancer coming through our doors for a very long time. I can't remember the last person. So most people come to us, they're stage 3, stage 4 already, and the majority of them have already done chemo and radiation and have been basically failed medical experiments, and then they have to try something new. And like I said on the onset, people are afraid and tend to get scared into doing something that maybe from a logical standpoint they wouldn't have done if they were able to think about it a little bit longer. And the longer they do think about it, and when they don't get the results that they were looking for medically, then they tend to start looking around at least. And that's okay. We're here for them no matter what. But we still get good results. I'm not a statistician. We don't keep stats on our patients. But earlier this year, my staff went back a year and a half, so now it's 2 years going back, and out of all the patients we started, which now would be close to 90 cancer patients in the last maybe 20 months, and we've only lost 9. So, and 2 of them were only with us, 3 of them were only with us less than 3 weeks, so they didn't even really get started on our program. So that's pretty good stats when you think of it. When these people are coming in stage 3, stage 4. We have patients that were given 2 weeks to live, and most of our patients come from Mayo. So 2 weeks to live to a month to live to 3 months to live, and they're not dead. So that's all I care about. We're doing well, and like I said, we're all going to die. We can walk outside and get hit by a bus. But as long as our mindset is right and we're not consumed by the disease that we're told that is going to destroy us, then I think it's a win.
Right. So even if somebody does get diagnosis, you get 3 months to live or something, that's not necessarily true.
No, it's not true. The doctor should be thrown in jail for even putting that in somebody's mind.
Right. Because then, then that gets that stress response going, like we were saying, and then
your mind's got this time set at 3 months to live. Oh my gosh.
So, it sounds like, too, that mindset is just a really big factor in people's healing.
It's huge. I mean, all we think about is dying of cancer. Cancer is the worst thing to get because people die of cancer. There's no cure for cancer. And in truth, if you really want to get touchy on this subject, most people die of the chemo or die of the therapy and die of the cancer. To me, cancer is like, and I hate to sound so brash or I don't at all want to sound egotistic, but it's like, no big deal. It's not that big a deal. We just see it in our office. That's all we see now, really, is cancer patients and the occasional chronic Lyme patient or really sick autoimmune patient. But I'd much rather have stage 4 cancer patient walk in my door than a chronic Lyme patient. There's very, very few people that are going to die of chronic Lyme. And nobody's going to walk in my door that's going to die of chronic Lyme. And I know we're going to be able to get them better, too. But they take a lot longer to get better. Whereas stage 4 cancer patient, we know we're going to see them turn around in 3 to 6 months. Every time. They might not live for another 30 years, but they're not going to die when they're told they're going to die. And it's just not that complicated.
Mm-hmm.
To make some right changes, correct the cause, and find out exactly from a nutraceutical approach and using the right frequency healing of what's going to be best for that patient to make them give them their best chance.
Mm-hmm.
So it's pretty cool practice, that's for sure.
Mm-hmm. Mm-hmm. Yeah, that's great. That's an awesome message. What if it wasn't such a big deal? It doesn't have to be such a big deal.
There's a lot of fear mongered in this industry, that's for sure.
Mm-hmm. Mm-hmm. So.
Cancer patients worth an awful lot of money to that oncology clinic.
Mm-hmm. Mm-hmm. And so that's kind of where the fear mindset starts to get coming up. Mm-hmm. Okay. Yeah, that's great. Well, that's a very empowering message and uplifting message too, and that's the message that I'm trying to bring to guys is that it doesn't have to be a big deal, and the body has this infinite healing potential, and it's just what you got to do is help your body in order to let it do what it knows how to do.
That's right. That's right.
Mm-hmm. Awesome, great. Well, I think that's all the questions I have. But I guess finally, say there's a guy out there who's just been diagnosed with cancer. What would you have any kind of final advice that you would give to him?
Well, the biggest thing is don't get scared into doing something that you may have regrets doing.
Mm-hmm.
You have biggest piece of advice you can give to somebody who's just diagnosed with cancer is that slow down and take some time. You always have way more time to make your decision than you're told that you have. Don't get into making, we got to get this surgery done immediately. The faster we need to do this surgery, the faster we need to get you started on chemo. I've had people pushed into it as soon as they got a diagnosis. They are scheduled for chemo the next week, and they weren't even asked to be scheduled. And it's just tell your doctor, I just want to think about this and slow down. If your doctor is that arrogant that he won't give you time to think about it, and you have other choices. There's other oncologists out there. So I'm not saying that you shouldn't use an oncologist. You shouldn't go the medical route, that you shouldn't do surgery or do chemo or radiation. Sometimes that might be appropriate in your case. But you have time to think about it rationally and make a logical decision. Slow down.
Yeah, just take some time and empower yourself with information and figure out all your options, and then you're going to be in a much better place.
That's right.
Awesome. Well, this has been great having you on. So people that do want to empower themselves with more information, definitely go check out Dr. Connor's website at www.upperroomwellness.com, and there you can download his book for free, Stop Fighting Cancer and Start Treating the Cause. And definitely a lot of great information in there and on the website as well. And thank you so much for sharing your information with us today, Dr. Connors.
And Joe, I appreciate all that you're doing out there on the East Coast. It's going to be a great avenue to send people, and you're going to be healing people out there. That's fantastic.
That's right. Well, thank you so much, and hopefully we'll talk to you again sometime.
Very good.
All right. Bye-bye.
All right.